Let's talk about rabies. So rabies is a virus that is transmitted through animal bites from high-risk animals such as bats, raccoons, skunks, foxes, and dogs and cats. It can rarely be transmitted through inhalation of the virus that is shed by bats during spelunking. The incubation is particularly long compared to other viruses, anywhere from 2 weeks to up to years, and it spreads very slowly via peripheral nerves to the central nervous system. And that's how it causes the symptoms. So, first, there can be tingling or numbness at the site of the animal bite. There can be a prodromal fever, headache, and malaise for a few days. And then after that, there are two forms of disease. One is the encephalitic form, which is more common, where there can be dysarthria, psychomotor agitation, dysphagia. There can be spasms of the throat muscles when attempting to swallow water, known as hydrophobia, or when a draft of air passes by, known as aerophobia. And aerophobia is particularly pathognomonic. There can be increased tone and hyperreflexia on exam early on. However, later when there are seizures and coma, there can be flaccid areflexia. For the other form, the paralytic form, it looks more like Guillain-Barré syndrome, where there can be an ascending flaccid paralysis with areflexia, and this will eventually lead to bulbar symptoms as well as respiratory insufficiency. For evaluation, the diagnosis can be made by detection of antibodies to rabies at the nape of the neck by skin biopsy. It can also be made by samples of the saliva, serum, or CSF. However, the antibodies at the nape of the neck, those are the most sensitive and specific. You must have a high clinical suspicion for rabies, and a history of animal bites is always helpful. On the CT head, you might not see anything in the early course of the disease. However, cerebral edema may be present later on. The cerebrospinal fluid can show mild lymphocytic pleocytosis and a mild protein elevation, usually below 100, with normal glucose. If a patient passes, the diagnosis can be made post-mortem as well. So immunofluorescence staining for viral antigens can be done, and these are diagnostic. There can also be a pathognomonic finding called Negri bodies, which are eosinophilic cytoplasmic inclusions in the neurons. These are not always found though. Because there is no effective antiviral treatment for rabies, the treatment is focused completely on prophylaxis. So first, after an animal bite, wash the wound with soap and water, and you can use virucidal agents such as iodine. Tetanus prophylaxis should also be considered. If the bite came from a wild animal, the animal is tested for rabies, and post-exposure prophylaxis is started if positive for rabies. If the animal is not available for testing, then post-exposure prophylaxis is started immediately. And domesticated animals can be observed for 10 days, and post-exposure prophylaxis is only started if the animal displays symptoms of rabies. The animal is then tested. The post-exposure prophylaxis can be stopped if the rabies is negative. So what is the post-exposure prophylaxis? It consists of rabies immune globulin and rabies vaccine. Pre-exposure prophylaxis also exists, and that is good old vaccination, and it is offered to people who may be exposed to rabies virus, such as veterinarians, lab workers, or travelers to endemic areas. And once vaccinated, you can skip giving immune globulin if there is a exposure to rabies. For prognosis, rabies is unfortunately universally fatal after symptoms appear, and death occurs within 2 weeks.